Hello, my name is Brinley McKague. I'm a student at Idaho State University, and this is my presentation on the evidence-based project comparing quality of home care in special need adults. So for this project, I've worked with special need adults and teens for over 5 years now. And so that's where my focus was when I started thinking about this project. As you can see, 28% of Idaho's population has disabilities, so that's 1 in 4 people. So it's a big part of our population that I've seen is often underserved. And I started to wonder where people live in relation to their care, whether that affected their quality of care, and mainly those with developmental disabilities, because sometimes those are disabilities that you can't see right offhand, but affect everyone's day-to-day living so drastically. So I began by looking for my PICO question, which was used for my research, and I was very specific in what parameters and definitions I needed. I was worried that if I didn't use the correct terms that I needed, or I wasn't specific enough, that my research wouldn't be applicable to my population. I chose to do an intervention type of question because I felt like it would yield the most results for my population, and I liked the action aspect of it. And of course, I had to define what was rural versus metropolis, and that was difficult to do. And I would probably refine this or find more research to support my definitions in this area. For the evidence that I needed to make sure that it was very reliable and that I could use it. So I used 3 different databases, the PubMed, the CINAHL, and the Cochrane databases. And I found 2 articles that really helped support my research. So the first one was a systemic review, and this one was done overviewing home care versus urban care in Chicago. And the results of that study shared that those who received in town or urban care received a higher quality of care than those people who lived in urban or in rural areas. So this was really important to my research. And of course, a systemic review is a level 1 type evidence, so I knew it could be trusted. And the second article I used was a randomized trial that was done in India, and it used DPOs or disabled people's organizations to help improve quality of care for disabled patients who lived in rural India. So, a disabled people's organization is an organization that has run people with disabilities for people with disabilities, and they help increase resources and access to care for these people. And the study concluded that the use of a DPO greatly increased quality of life and care for those living in rural areas. So, using these articles, I was able to create a plan for my project so that I could help my help my population. So I would have the DPO, one that would fit the needs of my population, those with developmental disabilities, combined with my internal review board. They would collect data through surveys, and we would have at least one person from a DPO and one from the internal review board to be able to work together to collect that information on the survey. A barrier that I really thought about was finding an appropriate DPO, so one that would accurately represent my population, adults with developmental disabilities, and one that would have access to our area. I was very worried that maybe an organization wouldn't be able to reach where our state was, so that was something that would need to be solved. And information could be shared by using a poster presentation to a small group of people. I personally feel most comfortable with this kind of presentation style, and I like that you could meet people face to face and be able to answer their questions in a smaller setting versus a bigger setting, which I feel it can be easy to lose control over. So for continuing our dissemination of evidence, we would keep reporting to our stakeholders. And for this project, the stakeholders would be the home health agencies we're working with, the Eastern Idaho Public Health Department. And if the project grew on a bigger scale, you would include more health departments, the staff of those home health agencies, and of course, family and friends of patients, because there are people who could really impact the care or access to some of these people, and they're obviously going to be very invested in the care of their loved ones. So change doesn't stick around, or success doesn't stick around unless we have change. So we would use the data to change policies and the way actions or interventions would be carried through the home health agencies. And this would require education as well for the staff. I've seen personally how difficult this can be. So I do think it's a good idea to continue to do studies and surveys in the region to make sure that this change continues for the population and so that we can continue to create positive impact. As I said, the DPO could use more studies. In the Indian trial that was done, they found that it was the first randomized controlled trial where the DPO had been studied. So definitely more information needs to be found. And we want to keep within the time frame of 5 years for this PICO question unless we decide otherwise. And we would use the same participants for the survey. And then data is only useful when it's shared. So it should be shared between the internal review board, the public health department, and with those members to bring change. And in conclusion, the goal is just to serve the developmentally disabled. So the IRB teams would work with the DPOs, we would improve rural care, and at the heart of it, every patient deserves quality care. These are my references. Thank you for watching.